I wanted to make a video about my experiences with a certain medication called Lexapro, and I've mentioned this to a bunch of people before, and I bet everyone's tired of hearing the story, but I just feel like it's something I want to talk about, especially on video, as it has changed the way my life has been in the past however long I took it, I think it's been a couple months. And yeah, I just want to talk about it, talk about the effects it gave me, as well as the after effects of it. Lexapro is basically escitalopram. The proper scientific name, or whatever the fuck they call it, is escitalopram, and it's a very common SSRI used to treat depression and anxiety and OCD or whatever. I've tried many medications before this one. I was on fluoxetine for a good while, few months, and that worked quite well. Never had a bad reaction to it. The only bad part of that was the withdrawal, but that's to be expected, to be honest, because I stopped it so suddenly after such a long time. The second antidepressant that I was prescribed, was sertraline, which both of those are very common antidepressants. Sertraline I didn't really give a chance, but from what I remember, it wasn't even that bad. It didn't really give me any reactions or anything, and I was pretty okay with it. But I feel like I didn't give it a chance to actually do something. In my opinion, antidepressants are just not for me, but it's kind of like a last resort. Just trying to, figure stuff out, see what works with my depression, because I've had depression for a very, very long time. I would say since primary school. I remember being really depressed, mostly because of my home life and just the way everything was going and my relationships with people. I was very on and off with that kind of thing. My home life hasn't been very good. I had quite I wouldn't say abusive household, but it was very erratic. So that's kind of the reason why I started taking antidepressants in the first place. Just because I wanted to kind of cure my depression instead of trying to live with it. And now I've accepted the fact that it's something I just probably have to live with, which I'm fine with, but obviously I'm still going to try and find other ways to kind of help it in some kind of way. Anyway, back to the Lexapro. I was prescribed Lexapro from a doctor because I was going through a really rough period of my life where I was having friendship problems. I didn't know what I was gonna do. I was starting work and it was really stressing me out. I'm now 20, so I was also worrying about kind of my future and moving out and stuff, which I haven't done yet, clearly, but I still think about it. It still stresses me out. But the doctor prescribed me escitalopram, aka Lexapro, and told me that it would give me mild side effects, because it's a very common antidepressant that a lot of people use and they've never really had an issue with it. But to be honest, I didn't really look that far into it. I just kind of trusted them. But they said it would give me mild side effects like nausea and restlessness, or just a lot of fatigue, really. And they said it was pretty normal to have that amount of nausea. But oh boy, I had so much nausea. It was fucking mental, as well as a whole bunch of other things. So, fast forward to when I got my prescription. Went to the pharmacy, picked it up. I was excited. I was like, oh my god, I'm finally gonna cure my depression. I'm finally gonna feel happy again. So I took one pill. It was 10 milligrams of Lexapro. And I took one pill. I felt really nauseous. I felt very wired. Everything just felt off. I had like this weird feeling in my body, and I felt like something wasn't right, but I kind of just trusted it because the doctor did say that it would give some kind of side effects, and I was like, okay, maybe this is normal. Fast forward to day 2, I split the pill in half because the side effects were kind of didn't feel quite right. So I was like, maybe it's too much. So I split the pill in half and only took 5 milligrams. I don't know if that's how that works scientifically, but I did it anyway. And that's kind of tipped me over. I think there was too much of a build-up of serotonin in my brain, and everything felt weird. I was starting to sweat profusely. I was getting like weird pains in my chest. I was feeling extremely nauseous, extremely restless. I was having panic attacks and all sorts of things. And it didn't feel very good. I do have a list of everything that I experienced. I am using my fucking phone as a flashlight, so yeah. So I have the list here, but I'll put it on the screen. I had nausea, excessive sweating, hot flushes, often in waves, slight fatigue, numb, restless, paranoia, sleep issues, appetite decrease, dissociation, vision changes, severe disorientation, panic attacks, intrusive thoughts, clammy skin, chest pain / tightness, diarrhea, and rapid heartbeat. So basically I called NHS 111, which is like the out of hours service for when you need like medical advice or like help or something, if you can't reach your GP like late at night or something. I had major panic attacks because I was like, surely this isn't right. Surely antidepressants don't do this. I've never had this with any other antidepressant I've taken, especially fluoxetine, which I took for a good few months, and I didn't really feel any sort of side effect with that. So I was very confused, and I told 111 my situation. I said what I was experiencing, and they were like, I mentioned the chest pain, and they fixated more on the chest pain because obviously they're gonna think that's like a sign of a heart attack or something. So they referred me to an out of hours GP, and the doctor called me back and said, right, what's going on with your chest? Like, what's the situation? I explained it to him, and he was like, alright, well, we'll send you an ambulance just to check up on you, because I think this was at like midnight, 1 a.m., something like that. They said they'd send an ambulance to kind of check up on me, see if everything's good, like my blood pressure, whatever else, ECG. And he basically told me that the ambulance wouldn't be there for another 7 hours, 6 hours, something like that. And I was like, fuck that. So he recommended I just take an Uber to the A&E. My recording stopped and I didn't realise because my whole PC locked down, and then I just kept talking because I thought it carried on and it didn't carry on. So basically I took an Uber to A&E and I walked in. It was not a good environment for what I was dealing with because at the time I was excessively sweating. I was really confused. I was very out of it, and my anxiety was so high. And I sat down. Well, no, before that they checked my blood pressure. They did an ECG on me. They were asking me things, and I assume everything was fine because I just went straight to the waiting room, and they didn't really like rush me in or anything. But I sat there in A&E for a good, oh my god, since fucking 1 a.m. to, I didn't leave until 9 a.m. Because what hospitals do is they do it in order of priority. And because I assume my blood pressure and everything was fine, and my BPM, whatever the fuck, wasn't really a priority. I did mention the medication, but I guess they just, if everything was fine, then I guess there wasn't really anything wrong physically with me. But I sat there and there was so much going on. I don't know if anyone's ever been to A&E in the UK. It is very underfunded. There's not that many doctors or nurses around. It's very all over the place. There were like 20 people waiting in that waiting room. One poor girl in front of me pulled a muscle in her thigh really fucking bad, to the point where every single movement that she did, she would wince in pain, start crying, start freaking the fuck out. She wasn't seen until like 7 a.m. And we arrived at the same kind of time, which is kind of crazy. But there was also a strange guy that was like shouting incoherent things down the hallway, and that didn't help my situation at all, because my symptoms were coming in waves. I was getting really hot, really uncomfortable. I couldn't sit still. My heart rate would go up. My vision would start going weird. My skin would be like tingly and it felt like there were bugs crawling under my skin. It was a very, very odd feeling. And yeah, there was just this man shouting incoherent stuff down the hallway, wandering around. I don't think he was like right in the mind, but you know, it really did disturb me. And I was surrounded by a bunch of old people in like those wheelie bed things. They looked like they were dying, I'm not gonna lie, but it was a very, very disturbing place. It was not fun. I had to get a blood test done as well, and if you know me, I am severely terrified of needles, to the point where if I look at a needle... The smoke's going in front of my camera. If I look at a needle, my adrenaline would start kicking in. I'd start freaking the fuck out. I can't even be near needles. They just scare me too much. But I had to get a blood test done, and this was 2 or 3 hours into waiting to be seen. It took me like an hour to actually work up the courage to just do the blood test, and it's one of those blood tests that checks kind of everything. But I went into the room. There was way more going on. Wow. There was way more going on in there, but I don't think it's my place to say, because A&E's a quite private place, and I don't really want to keep talking about all these unfortunate people, because it just doesn't feel right. But it was very, very depressing in there. So I sat down on this like bed, those kind of beds that kind of recline back, and there was this nurse, and she was getting all the needles prepared and the vials that they take your blood in. I saw that, I immediately went, yo, cut this shit out. I can't do this. I'm freaking the fuck out. I'm already dealing with the build-up of fucking antidepressants in my system. I was fucked. So I was sweating way more, shaking way more. My muscles trembling, everything was just shaking. So I was like, yo, can you just wait, like, a bit until I'm ready, and then I can come back to you? And she was like, yo, that's fine with me, take your time. So I waited in the waiting room for another hour, and then I went, fuck it, I've got to do this. I want to check if I'm actually okay. And I deal with health anxiety. Not as bad as I do now. I'll get to that in a bit. But I dealt with some health anxiety before my medication situation. I've always been convinced that I'll have a heart attack at any moment. And I was like, wait, this is the perfect time to figure out if my heart's healthy and everything else is healthy. Because I also had a fear that I had cancer, which you can spot in a blood test due to like the blood count or something. I don't even remember. But I was like, fuck it, I've got to do this. Not just for the medication situation, but just for my own peace of mind. So I did it. I didn't look at the needle. It hurt like a bitch. People say blood tests don't hurt. You are lying. Unless my pain tolerance is just so shit. It fucking hurt like a bitch. And I look away, she does it. Then I look back. I see the vials. I also see my blood on the floor. This bitch spilt my blood on the hospital floor. She wasn't even careful about it. But anyway, I went back to the waiting room because they told me to wait again just for the blood test results. That took 4 hours. 4 hours for them to process, which I don't know how long it takes to process blood tests. And I think everyone else had blood tests done as well, so I wasn't really a priority yet again. But I waited again. And then all of a sudden, they start bringing out little lunch bags. And I'm like, oh my god. A little buttered croissant with a pot of orange juice, a little toffee yogurt with some water and a banana. Say less. I'm scranning that. And I did scran it, apart from the orange juice. I'm not a big juice fan. But after that, there's this guy that comes along with a wheelchair. And I'm like, who's this wheelchair for? Then they call my name. And I'm like, if this guy is bringing along a wheelchair for me to go to another room, and he was hasty with it too, maybe that's not good. But I sat in the wheelchair, got wheeled down the hallway. It was kind of fun, I'm not gonna lie. I've never had that happen to me, but it was sick. Just getting wheeled around. I was looking around like, I looked around and it was all depressing, but still, it was fun to like kind of get wheeled around. But they wheeled me into another room. And I think it was like the normal, it wasn't A&E, it was just like a general waiting room for something. There were a lot of people there, and there was an entrance, so I assume it's just like a walk-in thing. So I was like, oh, maybe it's not so serious after all, because they wouldn't just bring me into a general waiting room where everyone else is. If it was serious, I'd be in my own hospital room with fucking IVs strapped to me. But anyway, I was in this room. It was pretty cool, actually. I was trying to like look around. Obviously my vision was a bit weird and I was still kind of freaking out about all the sweating and the shaking in my heart rate, and it was all over the place. I was looking around and it had like this really, I remember one thing about it is that it had like this cool sky ceiling. It looked really liminal, like, you know, the type of shit you'd see in like weird core edits where it's like a blue sky with clouds. They had that in the ceiling, and it looked exactly like that, and I was like, wow, that's sick. But I was freaking out too much. I didn't want to take a picture of it, and also it's kind of weird taking a picture of the ceiling of a waiting room when everyone else is around you, so I was like, maybe I shouldn't do that. I waited there for about 30 minutes, and they finally called my name. And it was this, like, young guy, this, like, don't know, like, late 20-year-old guy, like a doctor. And he calls me into a room, and I sit in the room, and I basically just describe my medication situation. I had the medication with me, because they recommend that you take the medication you're taking with you when you visit A&E, just to see what's going on. So I took the box of escitalopram with me. I don't think I have it anymore. I think I threw it away. I was about to show you, but I had the box with me, and I was like, yo, this shit, it's killing me. It might kill me. What do I do about it? He kind of didn't say a lot. I think he just said that it was just too much serotonin build up in the brain. But we were more focused on, like, the chest pain, like I mentioned earlier, the chest pain that I had. Because I think that's what the whole A&E was kind of just focusing on, because that is a serious thing. But he was mentioning the chest pain, and he was like, by the way, we got your blood test results. You are 100% okay. You're still iron deficient, but you're 100% okay. I've had iron deficiency for a while, so, you know. But they were like, yeah, your heart's completely fine. Your thyroid's completely fine. Fine. Your blood count is completely okay. Everything's pretty much tip-top shape, apart from, I think it was like, something was off, but that was only because I was hyperventilating so much that it kind of depletes that whatever it was. So he was like, yeah, that's normal, but it's like, yeah, you were hyperventilating, so obviously that's gonna appear abnormal in the tests. And I was like, oh, sick. Okay. What about the sweating and the fucking everything else? And he was like, oh, yeah, that's probably anxiety from the medication, and also, yeah, the buildup of serotonin in the brain. Just stop taking the medication if it's causing you problems. And I was like, sick. I'm glad I waited fucking 9 hours to hear this information. So, after A&E, I went home at 9 in the morning. I was still having my side effects. It was pretty bad. I had to like figure out ways to kind of ease the symptoms that I was experiencing. And I did figure out some ways of doing it, because what the doctor recommended is that I just kind of distract myself and wait for all of it to pass. I assumed that it would pass in like the next 2 days. It didn't pass until like a week and a couple days later. So for a whole week, I was experiencing probably the worst bunch of feelings I've ever experienced in my life. I was still profusely sweating. My vision would go weird. I'd have panic attacks. I'd feel my muscles hurt, and it was just so much. But I figured out ways to cope with it. I figured out that hot showers were the way to go, because that like eases the muscles, lessens the anxiety, because I was tensing so much. Spraying my favourite perfume on like a cotton pad and smelling it, watching YouTube videos, or playing dress-up games on my 2DS, stroking Jasmine. If you don't know, Jasmine's my cat. She's a little ragdoll. She looks like this. She's pretty cool. I would drink a lot of water. I'd try to eat good. I'd try to go outside, breathe fresh air. It was a lot. I didn't want to take any sort of painkillers because, first of all, I didn't know if I could. Second of all, the antidepressants gave me a severe fear of pills or any sort of drugs. Now, before Lexapro, I was smoking weed, which is a whole other video for a whole other time, but I was smoking weed for a good, I don't even know, since 18 years old. I would smoke weed every day. That caused problems in their own right, but I stopped smoking weed because you can't smoke weed on antidepressants, so I was like, okay, I'll just have to give up weed. But even after the antidepressants and all the symptoms, side effects passed, I still couldn't bring myself to use weed anymore. And nicotine and a whole bunch of other things, like even paracetamol and ibuprofen, like I couldn't stand any of it. And even just thinking about taking it for any sort of pain relief was just too scary. And it wasn't until like few weeks ago, a month ago even, I only just got used to taking paracetamol and ibuprofen, but I still only take one pill because my anxiety is just way too high every time I pick up 2 pills. So I start freaking out, and I keep thinking that 2 pills will kill me, even though I used to take 2 ibuprofens before and it didn't do anything. And all my organs are fine, so it literally won't kill me, but I keep thinking that it will. Still doing nicotine, like that hasn't changed. That's also a topic for another video. But I haven't smoked weed since almost 3 months ago now, which is crazy. It's the first time in a couple years, and I'm very proud of it. This video is only just to tell people about my own experience with antidepressants. Obviously not all antidepressants are going to do that to you. Obviously mine gave me some sort of serotonin syndrome. Unlucky for me. But Lexapro has worked with other people, and yet again it's quite a common antidepressant as well as fucking fluoxetine and sertraline as well. Like a lot of people take that shit. But Lexapro just didn't work with me. I would say it just didn't agree with me. It was too much. I think it's way stronger than the other ones as well. But don't take this video as like, oh, don't take antidepressants because they might kill you and they won't work. Do whatever you want, man. I mean, it works for some people. If you're unlucky and it doesn't work with you, get help for it, obviously. But most antidepressants do work with prolonged use as well as therapy. Like, antidepressants by themselves are not gonna help you. You do need to take care of yourself as well on the side. They're not the answer to everything like I thought. I haven't taken antidepressants since that incident, only because, one, the doctors have banned me from getting more because I told them about my experience and they were like, yeah, that's mild serotonin syndrome. And I was like, oh, that could have killed me. Thank you, doctor. So I'm not allowed antidepressants anymore, so if I want more prescribed, they won't let me have more. Also, I'm just severely terrified of it in the first place because what I went through felt quite traumatic and I would never want to go through that again, and I prefer life without pills. So, yeah. But if you find that antidepressants do help you, that is completely okay. I am very glad they do, and yeah. That is it. That is all I have to say. Now I'm probably gonna spend like fucking an hour or two editing this, because it's in three different fucking parts. So yeah. Thanks for watching, man.